Guys, welcome back to Medical Coding with Blue. Today's episode is all about how to become a CDI for non-nurses and for nurses, and where to find the best CDI training. If you are brand new to my channel, welcome. I am Blue. I'm a medical coder. Okay, guys. So CDI stands for Clinical Documentation Integrity. This is what it is formally known as, integrity. See, Clinical Documentation Integrity. Some people will call it Clinical Documentation Improvement, okay? So what this is basically looking at the documentation and finding out where the holes are in this documentation, as far as like, okay, well, the causal bacteria is not listed for this condition, so I'm going to go work with the provider and get them to make sure that they document everything fully. So the thing about this is it's typically done by nurses because they have that clinical background. They can look at something and see, okay, well, this is missing or that is missing. Or they can look at the labs and see, okay, well, you ordered this, but this is missing and it's not documented here. Where is it? The whole goal of CDI is to make sure that the highest level of specificity is documented so that the coders may be able to pick up the highest specificity of the diagnosis or the procedure. And with that, of course, it comes increased revenue. Now we do this as far like CDI as far as to make sure that the documentation is clear, not to, oh yeah, we're going to try to get the most money. The money will come on its own. But with a CDI, we are about making sure that everything is there and supported, and that with CDI, it is clear and as detailed as possible. So again, this is why nurses typically do that, because they have that clinical background and they can read like the labs as far as like, okay, what does this mean when it's low, and why did the provider order this, and let's make sure that it's documented and that kind of thing. So whereas a lay coder is going to be the type of person that'd be like, okay, well, we know as coders that we code what is there. And sometimes we don't know that there's a whole information that is missing, because we only know to code what is documented. If it's not documented, it didn't happen. So having that more specific lens of being able to see that is why nurses typically do this. But it doesn't mean that your regular coder can't do it. Even having years of experience, you start to build up that knowledge. And when you build up that knowledge, that's what makes you eligible to be a CDI. Now, there are two associations that I recommend for CDI credentials. Yes, there are three that offer CDI credentials, but two are the main ones that employers are looking for, okay? So if I do not mention your association and you know they have CDI credentials, it is because I have not seen employers looking for them as much as these top two, okay? So the two associations that I recommend if you are interested in pursuing CDI is the Association for Clinical Documentation Integrity Specialists, that is ACDIS. They are the leader. Now I will go into the requirements for, what it takes to get their CDI credential in a minute, but they do have two credentials, the CCDS and the CCDSO. Now, there's also the American Health Information Management Association, or AHIMA. Now, AHIMA has their CDIP credential, right? Clinical Documentation Improvement Practitioner. So these are the two associations that I recommend, and those are the three CDI credentials that I recommend. Now, before we get into what each one of these means, I want to say this. Being a CDI is a very serious undertaking. It is very serious in the fact that what you do and the effort that you put in can have a huge impact on a facility. Just like a medical coder, having lots of knowledge can have a huge impact on a facility. But that CDI person is going to be working directly with providers, and they are going to be working directly with medical coders. Now, I've heard it both ways, good and bad, okay? But I'm telling you this, if this is something that you want to do, you have to be able to communicate with alpha personalities in these surgeons or these doctors. You have to be able to talk to them. You have to be able to convince them and work with them, so that way you can, get more definition in these in these records as possible for these coders, but you have to be able to work with them. This is going to require you to have a lot of communication and be willing to be at the facility before anybody starts complaining. I want to say this too. Even though it says that you can be remote to do some of these CDI positions, I personally do not think this is right, because doctors get tired of seeing emails, and this also encourages them or it makes them want to ignore emails, especially when queries are coming in left and right and they're not really being told why, and they're not going to go to you and ask you why. Some will, but a lot of them will not. They're not going to ask you, because for them, they are a doctor and they don't have to answer to anybody. Whereas if you're in the facility as a CDI, then you can be able to build that relationship with them, and it's a lot harder for them to ignore you. Okay, so if this is something that you say you want to do this because you want to work remotely, pick another profession. Okay, that's all I'm saying. Because to be away from the providers when they need you to be there to educate them is terrible, and that's just my opinion. Okay, that I'm going to leave that aside. The other half of it is when you work with medical coders. Now, whether you're coming in as a medical coder that has been around for many, many years, and you have lots of experience and you know how to talk to other medical coders, you also have to make sure that you are willing to accept what they say. Okay, as a medical coder to another medical coder. It's the same thing for nurses. If you're coming in and you don't have all of the years of experience in coding, but you're the CDI, but you don't think that you need to listen to coders because you're a nurse and no one tells a nurse what to do, that's not the right attitude either. Okay, so you have to be willing to be openly communicating with the coders as well, because sometimes the coders are not really going to understand how to formulate the question either, especially the very green ones. They're not going to know how to formulate the question, but they can tell you what they think is wrong. And then either you have to explain to them why the doctor is correct, or take it to the doctor and say, you know what, the coder was right, and let's go ahead and work this out, and let's figure this out. So that's just a little part of one facet of the CDI. You have to be willing to work with all kinds of people. And just because you have this position, it's a position of a lot of power. So just make sure that you understand that, and make sure that if you are somebody that gets very shy and that you're always apologizing for things all the time and you shouldn't, you need to work on that. It's something that it's not just about the CDI part. It's all about being the entire package and being able to give those classes and being able to be on hand when the provider needs you, or to be on hand when the coders need you. I'm just saying. So that aside. So with AHIMA, I'm going to start with AHIMA first because it's the first one that came up. They have the CDI. Now, in order to be eligible to sit for the CDI, you have to have an associate's degree or higher. Now, they're not saying that it has to be specifically about the health field, but you have to have an associate's degree or higher, or you have to hold a CCS, a CCSP, a RHIT, or an RHIA. Those are the four that they will accept. Now, do I recommend that you have coding experience before you become a CDI, whether you are a non-nurse or a nurse? Absolutely. Because again, you being able to communicate with somebody who codes, and you have to be able to know what the coders are looking for, and you have to understand what the doctors are doing on their side. It takes somebody who has that well-rounded vantage point and understands, okay, I've been a coder before, I've been a nurse before, or I have been like a coder for many, many years. So I understand what these people are looking for. It's very, very important. If you skip one and you don't do it, or you just want to be a CDI, a physician educator, but you don't really have the background and the knowledge, it's going to show. It's going to show, and it's going to build a lot of distrust for the health information field. And so that, my friends, is why I say you always want to be prepared. I'm just saying. So in order to sit for the CDIP, Clinical Documentation Improvement Practitioner with AHIMA, you have to hold an associate's degree or higher, or hold a CCS, CCSP, RHIT, or RHIA. Now they say while not required, it's not required, but it helps, okay? A minimum of 2 years of clinical documentation integrity experience, so at least you know what's going on. Associate's degree or higher in a healthcare or allied healthcare discipline, okay? So again, it's not required. So you can have any degree and it's not required, but it is recommended, okay? Completed the coursework in the following topics: medical terminology, human anatomy and physiology, pathophysiology, and pharma, all right? And the pass-fail rates for the CDIP, again, these exams are tough, guys. These are not easy exams at all. In 2022, there were 334 first-time test takers for the CDIP, and 63% of them passed. So that's where it's been hovering. And the year before that, it was 62%. The year before that, it was 61%. These are very difficult exams. You have to know about how to formulate a legal query, all right? You have to be able to understand pathophysiology, and you do have to understand sequencing. You have to understand a myriad of topics, okay? So I'm going to leave the link for this in the description box below. That way you can find out more information on it. The passing score for the CDIP is a 300. This is a 3-hour exam. There are 140 questions, 106 are scored, and 34 pre-test questions that are mixed throughout, all right? And you do have to take this test at Pearson VUE. And they are in currently, let me make sure, yeah, they are currently in the beta period, which started on June the 1st. So if you're about to sit for the CDIP, it may be a while before you hear your results. I'm just saying. So that I'm going to leave there. And then, let's see, for, okay, let me talk about the domains. The domains is the clinical coding practice is 15 to 18% of this exam. The education and leadership development is 21 to 26%. So that's heavily weighted. All right. So just make sure you got your focus there. And then of course, record review and documentation clarification, 27 to 33%. That is very heavily weighted as well. Then they have CDI metrics and statistics is 8 to 11%. Compliance is 18 to 23%. So you really have to know all about compliance, and you really have to understand the guidelines. And that's very, very key. It doesn't matter what CDI credential you're sitting for. You have to know those things. Those are the core foundations, okay? Because ACDIS and AHIMA are very closely related. They work together a lot. So the standards for their tests are going to be essentially the same, you know. But with ACDIS is a little harder. And I will say that because their requirements are a little bit more stringent, all right? So for the CCDS, right? Certified Clinical Documentation Specialist. I got it right. Okay, in order to sit for that, this is with ACDIS now, okay? ACDIS, again, is the Association for Clinical Documentation Integrity Specialists. In order to sit for the CCDS, and that is more geared towards the inpatient side, right? Like MSDRGs and all the good stuff. You have, the requirements are possess an RN, RHIT, MD, or DO with 2 years of experience as a CDI specialist, or have an associate's degree in an allied health field and 3 years of experience as a CDI specialist, or you can have formal education in human anatomy and physiology, medical terminology, and disease process, or the CCS or CCSP credential and a minimum of 3 years of experience as a CDI specialist. So if you are not a nurse, you can still sit for the CCDS if you want to do the CDI on the inpatient side, okay? And that's going to be all about your MSDRGs and all that good stuff. So if you want to do that on the inpatient side, you have to have a CCS or a CCSP and at least 3 years of experience as a CDI specialist in your work, okay? And so you can be a CDI without being an RN, all right? Now for the CCDSO, the Certified Clinical Documentation Specialist Outpatient. Now, if you are working in the physician side and you are doing like clinics and things like that, this may be a good one for you, okay? So CCDSO prerequisites. It says list their documentation specialist experience. Applicants may be audited to verify work history and educational background, credentials, and licensure. Again, ACDIS is very stringent in their requirements. So just make sure that you understand that. They are the gold standard for a reason, okay? Have at least 2 years of experience as an outpatient documentation specialist or 1 year in the inpatient setting and an additional year of outpatient CDI experience. Once a candidate has accumulated the time, it does not expire. Meet the work requirements prior to submitting their application. Candidates must have one of the following two education and experience standards. Candidates must meet one of the following two education and experience standards. A clinical licensure, RN, MD, or DO, or coding certification, RHIA, RHIT, CCS, CPC, CRC, COC, and at least 2 years of experience as an outpatient documentation specialist using United States reimbursement systems, okay? And then there's the other option, which is number 2, a clinical licensure, RN, MD, DO, or a coding certification, RHIA, RHIT, CCS, CPC, CRC, COC, 1 year of experience as an inpatient documentation, clinical documentation specialist, and 1 year of experience as an outpatient documentation specialist using United States reimbursement systems. A year of experience is defined as full-time employment or greater than 2,000 hours of working during that year. And then, of course, what essential functions define an outpatient documentation specialist? Outpatient documentation specialists conduct reviews of medical records for patients in a variety of outpatient settings, including but not limited to physician offices, physician and hospital-owned clinics, ambulatory surgery centers, and hospital emergency departments. Collaborate with physicians and medical team members caring for the patient to clarify clinical documentation, apply their clinical knowledge to evaluate how the medical record will translate into coded data, including reviewing provider and other clinical documentation, chronic disease processes, medications and their indications, diagnostic information, and treatment plans. Communicate with providers, whether in verbal discussion or by query, for missing, unclear, or conflicting documentation. Educate providers about optimal documentation and identification of disease processes to ensure proper reflection of severity of disease, complexity and acuity, and facilitate accurate billing and coding, and understand risk-adjusted payment methodologies, professional coding and billing, and outpatient facility coding and billing, and share this knowledge with providers and members of the healthcare team. So that is, in a nutshell, what these credentials are requiring, right? For this one, for the CCDSO. So again, it is possible if you are wanting to do this, to pursue this, it is totally possible to be able to do CDI without being a nurse. And again, for my nurses, it's just something that you all ought to know. These are the options that you have as well. Now, to get to the best training program for CDI, in my opinion, because I personally went through this program myself. I went through this in 2021, but there was other things that I had going on, so I have not yet pursued the CDI credential yet. Okay, it is a lot. There is a lot to it, and there's a lot you have to know, especially for my non-nurses. For those that are non-nurses, you got to make sure that you up your game on pathophysiology. You have to up your game on pharma as well, and you have to really understand the sequencing, and you really got to understand the guidelines. So make that a priority if you are a non-nurse. For my nurses that have not been medical coders, make sure that you brush up on the coding, and those coding guidelines are going to go a long way to helping you understand what we do in the first place. go with a workbook so that way you can build your knowledge and understand for ICD-10-CM and ICD-10-PCS and CPT. All the books that I recommend for those three are in the description box below. Everything you need to know for independent study is there. So the best place that you can go to get CDI training is a boot camp. So boot camps are 60 days. 60 days is fast. But this means if you're going to take this CDI boot camp, this means that you already have a base knowledge and an understanding already. It's not like you're somebody off the street who doesn't understand coding or doesn't understand what CDI is. This is supposed to augment your knowledge, okay? So that's just something that I gotta say. I personally went through this program. This is the Clinical Documentation Integrity Boot Camp Online, and this is offered through HC Pro. I will leave this link for this course in the description box below. I am not getting paid for this, okay? This is not an affiliate link, all right? But this is the best place that I have found that it was very comprehensive training, okay? So it is $1,299. Now, before you say, well, Blue, that's $1,300, I can't afford that. If you're employed right now as a medical coder, talk to your HR department and see if they have educational funds. Sometimes they do, and people don't take advantage, okay? And sometimes if you say, well, this is related to my work, can I apply for this? And sometimes they say, yeah, we'll go ahead and give you the money for it. So just make sure that you check your other options for paying for this course, okay? And so if you get it through your employer, that's all the better, because you know why? That's going to make you more valuable to your organization if you're allowed to get this education. And again, they sometimes have funds for education, but people don't take advantage of them because they either don't know or they're too scared to ask. All you can do is ask your employer, hey, is there funds for us to have a training? Because I see a CDI program that I think would be beneficial, not just to myself as a professional, but to the organization as a whole, because I can assist providers and be even more educated by bringing them this information and helping us to have more clearer documentation so that everything is more detailed, right? So in this program covers everything that you need to know for CDI. And this training, prep, I wanted to say prep and then I was like training prep. This training will prepare you for AHIMA or AAPC, AHIMA or ACDIS, okay? I'm always talking about coding, that's why I said AAPC, I'm sorry y'all. But it will prepare you for either examination. Of course, there are prep guides out there. I will say though, I have the CCDS. It is not a typical workbook. So if you get it, it will help you, but it's not a typical workbook that's going to ask you a lot of questions like a normal workbook would. CCDS and CCDSO are also available in the marketplace for HC Pro. It's about $135 for those manuals, I'm just saying. But in the CDI course for HC Pro, you will learn about healthcare data and the health record, Medicare and Medicaid, diagnosis codes and sequencing, introduction to procedure code sets. This covers CPT and ICD-10-PCS. I'm talking fast because I'm about to run out of time. The inpatient prospective payment system and MSDRGs, record review and queries, getting to know the DRG expert, key infectious diseases and complications, key diseases associated with injuries in the musculoskeletal system and the skin, key diseases of the respiratory system, key diseases of the digestive, hepatobiliary, and urinary systems, neoplasms and associated diseases, key diseases associated with the circulatory system, key diseases of the nervous system and mental health, and then key endocrine, nutritional and metabolic diseases, and basic CDI metrics and professionalism. Again, everything that you need to know for any one of these 3 exams is going to be covered in this program. And I'm telling you, it is a fantastic program. They worked in conjunction with ACDIS on this, and they are the ones who basically designed it. So again, you are learning from the leader, and that is really, really important. So if you are a non-medical coder and non-nurse, and you want to do CDI, by all means go for it. But study hard. And if you are a nurse and you want to get into CDI, learn the coding as well, okay? Learn the coding because it's only going to benefit you, all right? That's just what I'm saying. So I'm going to go ahead and wrap this one up. If this video was helpful for you, please like, subscribe, and share, and I will see y'all next time. Bye.